So very good afternoon, ladies and gentlemen. Thank you so much for joining us today for our webinar on trauma psychotherapy, symptoms, causes, and treatments. So today on this session, it's going to be an interactive session. If you have any questions, please do feel free to raise up your hand. Do feel free to write it down on the chat. I will take a look and we will answer all your questions as soon as I see all the questions coming in later. And to speak about this, most people will experience a traumatic event at some point in their life. Some may experience symptoms of shocks and distress, and most will recover within a short period. A minority will experience more long-term traumatic effects, such as the development of PTSD. Therapy and self-care can actually help those with persistent trauma symptoms to manage these symptoms and improve their quality of life. So, ladies and gentlemen, it is my honor to let me introduce you our honorable speaker of this webinar, Dr. Edward Chan, a PhD holder in psychology, a completed Master of Science in Learning and Master in Nutritional Medicine, Bachelor of Science Honors in Psychology, and Postgraduate Diploma in Corporate Psychology. He is also the Principal Consultant at PsyCorp, a Center for Corporate Psychology, a board-certified corporate therapist with the Malaysian Association of Psychotherapy and the International Society for Psychotherapy, Counselling and Psychiatry Fellow of the World Council for Psychotherapy. Apart from all this educational and professional background, Dr. Edward is also an invited speaker for the 9th World Congress for Psychotherapy for the year of 2020, keynote speaker for the 4th International Psychotherapy, Counselling and Psychiatry Conference 2020, and invited speaker for the 34th European Psychiatry Conference on Schema therapy. And also not forgotten that Dr. Edwards has also done his remarkable contribution to the world through his writings, as he is also the author of several books with the title Dancing with Crocodile, Key Strategies of Corporate Psychology, and Love is Never Enough. Apart from all that, multiple of his work has been published in the Journal of Cognitive Therapy and Research, Journal of Reattached Therapy and Developmental Diversities, International Journal of Psychiatry, and he is also an accredited reattached therapist. I got it right, Dr. Edward?
Yes, very good. Thank you so much for the kind introduction. And
Okay.
Joanne, of course, is one of our graduate students in adult psychotherapy, right?
PS 100.
Yeah, yes, adult
Assessment.
psychological assessment. And you'll be doing the therapy soon.
Yes, yes. Of course, with your guidance and all, I mean, you have helped me a lot. Let's come back to the topic that we're going to speak about, trauma. I think a lot of people kind of like mistaken about having trauma or PTSD. Now, let's begin with what is trauma?
Yes, I think maybe a lot of people are familiar with PTSD, post-traumatic stress syndrome, right? And with PTSD, there are normally like a single event, like we hear about 911 or very traumatic events. In fact, we have some patients now, currently that we are doing therapy, for them when they have been to war, been to Iraq and all that, right? So that is a very traumatic event, or maybe we also in the past have a patient who has been robbed, may have been raped, so these are like single traumatic events. That is PTSD, classic PTSD, where you continue to experience a lot of symptoms after the event, like flashbacks, your bodily sensation, so this is a diagnosable disorder in our DSM-5, the Diagnostic Statistical Manual that psychologists and psychiatrists use to diagnose disorder. But of course, we also have so this is relatively shall we say uncommon, right? Many of us do not experience those single very traumatic events, right? But on the other hand, what is more common is what we call complex PTSD, right? So these are more subtle trauma, right? That most of us would have experienced, you know, like you mentioned, most of us experience trauma. So by which we don't mean the, you know, the very traumatic event, but nevertheless this trauma, like childhood trauma where our needs are not met. All right, and we will talk more about what are those childhood needs repeatedly. Then we might experience this what we call complex PTSD, right? Which are much more common.
So like you mentioned, there are actually several types of trauma, right?
Yeah. Well, the two main type, you know, the single classic PTSD and the complex PTSD.
Okay, right. So when you speak about childhood, let's begin with childhood. Now, when you say the needs are not being met as a child, we speak on child first, then we move on to adulthood.
Right.
Now, if this issue is not, let's just put it as an example, abusive.
Yes.
If it's not treated, how would child?
Well, first of all, we need to define abuses, right? Many of us would associate abuse with physical abuse, sexual abuse, but actually there are many forms of abuses. Emotional abuse, right? Social abuse, when you know you are like isolated, you know, by somehow by your parents or family, you know, like they're being overprotective, that will be social abuse. Intellectual abuse, you know, you're not allowed to like question things and ask for things, you know. Emotional abuse, definitely. Verbal abuse, you know, being called names, you know, by others, by your parents. So in fact, anything short of optimal nurturing is abuse. So the term abuse can be very subtle, and of course, as an adult, you know, we tend to minimize all these abuses. We tend to deny and even minimize them because we don't, especially as a child, we don't want to think bad of our parents, right? Especially in our Asian, you know, family culture, it would be unfilial to think negatively of our parents. But also psychologically, that there's you know, a more psychological reason for not thinking you know, negatively of our parents and caregivers, because it is very threatening, right? So when you think, you know, they keep on telling you that you are bad, you know, and all that, and you or useless or whatnot, all right? So these are all very abusive, verbal abuse and emotional abuses. So in today's session, we are not trying necessarily to blame our parents or caregivers, all right? So let's state it on the you know, on the upfront, and many of them, I'm sure, try, you know, their best to raise us up, you know, in as much as they can in the best way that they can. But nevertheless, they themselves, you know, do not have the technology to do so. Maybe, you know, from the abuses they suffer from their own parents. All right. So this is not to today's session is just to give us an understanding, you know, of all these impacts and how we can break them. Right? How, like, you know, what we call break the sins of our father, so that we do not pass this negative effect, psychological impact of trauma to our own children, right? So that is the objective, rather than finding blames on our parents and caregivers. So the unwittingly we suffer all these abuses, but the complexity is we tend to minimize them either as children or adults, and even deny them, right? And I have so many patients that do that, and they'll say, no, my father was a bit strict, but I know recently I had a patient like that, but I did this give me help me to become who I am. So that they felt the strictness, the abuses help them to become like a perfectionistic person, achieving a lot, but that is just rationalization, right? So what we need to do is to really acknowledge all these abuses before we can move on.
What are the signs that we should look at if a child is being, having a trauma, distress and all that? Would the kid be a little bit more reserved at the corner, or I don't dare to say anything? What are the...
Yeah, it depends on the specific form of abuse. Like we have this a mode. This is a mode card, right? Mode are like a type of behavior, like coping, right? So this is called the punitive critic mode, right? So what this behavior is, the parents might be pretty punitive, right? They may either beat you up for not, so certainly I myself suffered that,
or maybe one person in the family, one kid did wrong and the rest,
yeah, indeed,
bear the consequences as well.
Exactly. Yeah, I mean, we have the good, bad, and the ugly. All right. So the good is, yeah, our parents are not perfect. Maybe sometimes they do the punish us. They do use corporal punishment. But if you are good enough parents, they might apologize. That is if that is possible, that's great. Very often that is not possible, but it doesn't happen often, and they try to repair the punishment. So that would help. That would normalize things. But the bad would be when that often happen a lot and there's no repair, and the ugly would be where that that is a totally bad, right? So there are three different scenarios that can happen.
Okay, so this is one myth, right? Myth or facts? Children who has been in trauma, would they grow up to be violent?
Well, it depends on the type of trauma, right? I mean, I know you have an interest in forensic psychology, Joanne.
Yes.
but
yes, because a lot of the research I did is that
yes,
they actually come from broken family, and they've been through a lot of anxiety, they've been through a lot of trauma, and that's when they become violent, when they become adult.
Yes.
Not all,
yes.
not all.
Well, that is certainly the research. Most abusers themselves have a history of abuses.
Okay, I have a comment here from Zoe. She said that most psychopaths come from abusive backgrounds. Your thoughts, Doc?
Well, the term psychopath is a very specific term, right? And that there is a combination of physical and psychological causes for this, right? Yeah, the physical one might well include the genetic factors as well, right? So abusers alone might not be sufficient to turn someone into a psychopath, right? But certainly abusers, especially early abusers, have a big physical, neurological impact, right? To someone's brain, you know, to the child's brain, that would affect them lifelong. And of course, this can be healed as well, right? But a psychopath would be a person that is quite incapable of empathy,
Right.
right? And then that have been specific research done that, you know, on, and so that is more than just maybe a psychological effect, although that would have a big contribution. So yes, there are both psychological and physical contribution, and the psychological abusers will most likely turn on, you know, the anomalies that has the predisposing physical features, you know, will get turned on by the psychological factors such as abuses.
Yeah, I actually did one case studies before. It's that if a child is born with a brain damage and you abuse that kid since very young and for a long time, and the possibility of that person's going to grow up be quite violent because of the brain damage and the abusive. So that was my take on that. Now we have spoke about the psychological part. What about the physical part? How would a person react, like heart rate when they go through a trauma?
Yeah, I mean, like for example, you know, if you get beaten up, you know, by your say parents,
right? I would run, I would hide.
Yeah, or shouted at, and especially, you know, when it is not consistent, right? Yeah, and it depends on the mood of your mother, say, you know, and you never know what mood she's going to be. Then the whole emotional safety, the emotional environment becomes, you know, very questionable, very unpredictable. So you're always treading on eggshells, right?
Right.
So you're highly vigilant, you know, and your brain, you know, neurons will be adapted as such, you know. So as a result, you carry this consciousness, highly vigilant type of coping into your adulthood, you know, with your partner, for example. You know, you are always on the vigilance, always on the defensive, and that is a coping mode, right? That you either you become very detached, or you become avoidant of intimacy, right? So these can be
the coping
some
mechanism.
Of the impact. Exactly. What we call the detached coping protector, or the avoidance self-soothing. So talking about comorbidity, right, which is a term
right.
we use for the associated psychological disorders. You suddenly have a lot of like addiction, for example, with those suffering from trauma, either from drugs, right, from alcohol, you know, pornography, whatnot, right? So these are again coping mechanism that you know.
Interestingly, when you said about pornography,
well, it's very self-soothing, totally, right? So we did, I think, a webinar on addictions.
Addiction, yes.
Some time ago. So the problem with addiction is not the actual addiction, but the underlying emotional causes, which is trauma itself. Right?
I remember that webinar. You said something. Anything that is pleasurable, it's addictive.
Right. Yes. But if you don't have a trauma, you know,
right,
then it might not be as addictive. But if you have a trauma, then you're using it like Zoe mentioned that as a way to escape from your emotional pain, to soothe yourself. So that there's a coping mode called self-soothing avoidance. Right. You know, you are using it to avoid the emotional pain.
What about depression?
Well, yeah. The depression is another psychological disorder where you literally depressed. That means press down, right? Press down your emotional pain. But the problem is we cannot select. When you shut down everything. You shut down joy as well, and that's why you feel depressed, right? You cannot select. I know I just want this pain to go away. When you try to shut down everything. You become empty. So the depressed is not necessarily someone feeling sad. You feel empty of all emotions, right?
So it's also depression other than addiction. So depression can also classify as one of the coexistence of trauma.
Yeah, indeed.
Addiction. Any other coexistence disorder?
Yeah, we talk about rapid heart rate and all that, panic attacks.
Right.
Yeah, and then all the permutation of anxiety, to all the way to OCD, obsessive compulsive disorder. You try so much to distract yourself from the emotional pain, that you might employ this type of coping as well. Okay. So indeed, and that's why we use the term complex, right? Because there are a complex series of psychological comorbidity, right? And there are also personality disorders, like borderline personality disorder is a very common comorbidity, with trauma. We have done a previous webinar on BPD.
Okay.
Yes.
Now, for those who might not be familiar with BPD, would you like to just give a quick summary on what is BPD?
Yeah, so there are a series of characteristics, right? Psychological characteristics, and there are like 7, and these are again a DSM-5 diagnosable disorder, personality disorder. And some of it would be like, for example, the emptiness, a constant fear of emptiness, unstable relationship, inability to have intimacy. So many of the features that we have talked about, right? Are part of BPD, right? And it is in order to treat that, you might need to go back to treating the trauma, helping the person to,
the roots of
heal. Exactly, to heal from the trauma.
So Vijay, I have a question. Can children with trauma can be treated, and can they come out of it?
Oh yeah, and that's why we are in the profession we are in, because there's hope, right? And this is a very important message to send out to folks, that their hope, all these are treatable, right? But the first step, for adults, at least, is to acknowledge that there is trauma, rather than avoiding, detaching from them.
Now we will get to the treatment part later on. Is there any more questions that for those who are still do not understand about trauma, the symptoms in terms of psychologically and physically? You can drop us a questions or message, or else we would move to the next, which is we're going to talk about.
So in in terms of courses, that there are psychological program we call Schema, right?
Okay.
So these are one of the core contributing schema of people having trauma, which is the vulnerability to harm schema, right? So as a child, we need to feel emotional safety. So with trauma, that is absent, right? You don't know when you're going to be hit, when you're going to be shouted at, right? So that's need for emotional safety, therefore, has been robbed.
Okay. Zoe says that, what about bipolar? I think what she meant is the coexistence of trauma. Does it?
Right. Well, bipolar is more a physical, the condition that there are the specific neurotransmitters that give rise to the mania, as well as the depressive cycle, right? So it's not the same as a major depressive disorder, which are more caused by trauma.
Mm-hmm. And also, does trauma change the brain structure?
Totally, yes. This is what we are finding out more and more. That there is intimate interconnection, for your information, the brain connectivity, right, of a child do not get stabilized until they are in their mid-20s, right? Okay. And for boys, for men in the 20s will be men, will be much later than even girls. Okay. Right? So they do not get stable. So all this time, it is pretty the brains are pretty vulnerable to being susceptible to being traumatized. So certainly, all right. But even after that, there is this notion of brain plasticity, right, where the brain continue to evolve, even after the 20s. So the brain change all the time. Okay. Even with us now, it keeps on changing.
Yeah, we can never stay in the same phase.
Like, but
my 20s are
especially
different from my 30s.
But especially, in childhood, in teenagers, and even in the 20s.
Interesting question from Kamini. She asked that, Doctor, may I know what it means that the body remembers the trauma?
Yeah, because and this is the limitation of CBT, right? For those of you who do CPT, which is mainly cognitive, right? And it has its role, of course, but then the body encode trauma in a very experiential, what we call felt sense way, right? In the body has its own memory. So there are there are different types of memory. So there is this what we call episodic memory. This is a memory of an event. I remember what I had for lunch just now and all that, right? So these are the content. But there's also the the memory of that are more subconscious in your body, or your know-how, and your body reaction, to an event. So these are deeper layers of memory that are more subconscious. Like I mentioned, just now, if you're like regularly hit, by your caregivers, right? So all these are encoded, all these highly vigilant coping, So when your wife raise her voice a little bit, then you will be like shuddering, am I going to? So as a result, you might then tend to like comply and surrender. You don't express your needs as much, right? Because you have learned, to suppress your own emotional needs, right?
Does the Zeigarnik effect apply on this?
What effect?
Zeigarnik, like the unfinished business thing. It's
oh yeah. Of course that for that we are going into healing already, right? So one of the way to heal. So there are two ways to process this trauma. We can talk about it in regular psychotherapy, right? But a more effective, well, not more effective, but a more complete way is the experiential way, right? Where you regress back to your childhood, and you express your anger towards the offender, the abuser, all this need to be processed, right? All this hidden anger you have, the grief, the loss, the sadness, all these emotions that you carry need to be processed and need to be processed experientially, right? So then your brain can rewire, right? In some ways.
Okay. Now we are halfway through to our webinar. Let's move on to the treatment. Okay. Now let's begin with child. What is the best treatment method for a child?
Well,
play therapy or
totally, yeah. So we have something called filial play therapy. All right. So these are for parents and the child to have the parents and the child bond. You see that the problem with a lot of parents is they don't know how to play with the child, right? So they equate playing with teaching, right? This is an aeroplane. This is whatnot. This is dinosaurs, triceratops, or so that is there are time for teaching, of course, but real playing is not about that. It is about exploring. It is about expressing, creativity. So you don't impose, right, your structure onto the child. You want to facilitate the child creativity, and also like the child asks you what is this, right? So your answer should be, you can call it whatever you want. It can be whatever you want it to be, right? So that will immediately give back the power to the child that they can express themselves, rather than this is triceratops, or whatnot, right? So that is not the proper way to play expressively. So we have a program that we teach parents to really play properly with the child, so that the child feel totally safe to be able to express themselves emotionally, creatively, right, in play. So definitely play therapy can rehabilitate back, some and heal some of this trauma effect, by the therapists, but ultimately with the parents learning the proper way to play with their children, right? Yeah.
Now that's for children. What about adult? Like Barbara have a question. She asked that, can we come back to the trauma through therapy and change the trauma, not the scene, but the interpretation of my client, like think better about the same problem, getting a new perception.
Yeah, so with trauma treatment, there are a few what we call evidence-based treatment, right? So
not
maybe,
heard of this treatment.
Yeah, so maybe Zoe, you can share with folks about the EMDR event that is coming up, I think in June, right? So EMDR is therapy is called eye movement desensitization, EMD desensitization reprocessing, right? So this is a treatment that was founded by Shapiro. She was EMDR. A psychologist. Yeah, that was like she was diagnosed for having cancer, and she was walking by the beach one day, and she found herself like flickering her eyes, and then after that she find that the feeling and fear for the cancer has dramatically reduced, and then she did further processing, using the same eye movement way, and the cancer was gone, right? So she found that at that time it seems a bit magical, to folks, and there are a lot of psychologists that were very skeptical about that, but now it is what we call evidence-based therapy. There are a lot of researchers and evidence found to back this, and it's simply explained psychologically by taxing the working memory. So we have something called working memory, and this is where, you know, we talk about the memory of the trauma, right? So but the thing with the working memory is it has limited capacity, right? So when you text it with the eye movement processing, then the memory for the trauma becomes more distant, and become we would have less hold on you. That's how EMDR works. It's very effective. I've been training in it, and we use it for many of our patients. It's very fast and quick, and you don't have to go in to a lot of the details of the trauma itself, right? So that is one way, and we have a training coming up, and for folks who want to get themselves trained in this technique, right? Yeah. And the other one, which is effective, which involve going back in more detail into the memory of the trauma, is called schema rescripting, right? Okay. So this is like schema therapy, where we use a lot of experiential technique to regress the patient back to the scene of the trauma, confronts the offender, the perpetrator, right? And get some closure to it, and the therapist would need to know how to facilitate it, so right, that if there is no way, like we will ask, you know, what, you know, we will like scold your mother, for example, if she like you know, abusing in some way. And then we will ask the patient, you know, what would your mother do? And some patient would say, you know, she is unrepentant, and she asks you to get lost. In which case, then we will then make the mother disappear, and we do some reparenting, right? So we will rescript the memory, and which will give rise to new physical brain connection. So this is a very powerful, you know, it's almost like hypnotherapy, but with a specific process to rewire the brain. Okay. Right. So they have new memory about to replace the traumatic memory. Okay. So that.
Before we answer the couple of questions, just a very quick one. Now, consciously, we are ready to fix our trauma. We are ready. But what about during going through the process, during the therapy? What about the subconscious are not ready? Have you ever encountered cases like this, like during the therapy, and then suddenly it just went off?
Yeah. So that is why the therapies are well prepared, you know. So before we even go into the therapy, we need to give resources, right? We need to give resources to the patient, right? That they have enough self-esteem. They know how to like calm themselves down. They're given some psychoeducational techniques, you know, how to go into a safe place, you know. Right. So all these resources are given, but of course that there's no knowing that they can be triggered into what you call a memory, you know, and they can even disassociate, right? So one more thing that we haven't talked about in trauma is disassociation, right? This is one coping method. You know, you probably heard of the old term multiple personality disorder.
Right.
So the new term is dissociative identity disorder, which is similar, right? Okay. So you use a specific ego state, right? And which is not that uncommon with most of us. Most of us have if you like different personalities. Right, but the difference is most of us know, right? When we are one or the other personality, and that's why we have Housestone, you know, cells in a box. We have this multiple cells. Houston is a Jungian person, and then you have these various so personality. So one of the big personality is the inner critic, right? That we have, and one of the way that we need to get healed is to give voice to the inner critic and embrace our inner critic, right? So this is a good book I will recommend for that. So that is one of the way we cope to have all these different identity personalities, right?
Oh.
Yeah.
Okay, let's answer some questions. Yeah, I read somewhere that people with altered prefrontal lobes cannot be saved. Hence, serial killers will never be rehabilitated. Doctor?
Well, we won't want to say never in as a psychologist. I am of the humanistic tradition, whereby we believe everyone have resources and we can heal everyone, right?
Right.
Yeah.
So that's also answer your questions, right, Zoe, about will every human who has undergo trauma be healed through therapy?
Well, about the prefrontal lobe, of course, if you have some prefrontal lobe damages, it will be more challenging, because our prefrontal lobe are the part of the brain that help us to exercise control, right, over our impulses. So if there are lesions there, that there will be more challenges. But at the same time, like I mentioned, the brain is pretty plastic, right? So it can be rewired through therapy, right? For the connection to be done elsewhere, right? And to be even the prefrontal lobe to have more connections back. So all that is possible. We have a neurofeedback, for example, which is another very good technique, right? For that usage.
I'm going to combine these two questions together. One is what's other way to treat trauma other than hypnotherapy, which is from Ashley, and also Andy. I think I can combine these two, because these two, it's a psychotherapy, hypnotherapy, and also empty chair. Empty chair can be dangerous when dealing with PTSD. So maybe you can explain a little bit about empty chair for those viewers who are watching that they are not familiar with this technique.
Yes, empty chair was technique popularized by Fritz Perls in Gestalt therapy. Right, and it's probably originated from Moreno in psychodrama.
Yes.
So psychodrama is a very confrontational type of therapy, but even that, if you do it properly, it is quite safe, because the patient themselves do not get into the therapy directly. They are more an observer, to then increase their awareness about the traumatic events. So all this type of therapy has the objective to increase awareness on the traumatic events, rather than denying, minimalizing the events, that they can acknowledge, and then so that they can process and deal with the trauma, right? For empty chair, you have maybe a direct confrontation with the perpetrator, say your mother, your father, sitting on opposite you in the empty chair. Right, and you have the chance of, like what I mentioned just now, of processing, in the trauma. So you're going back, to that memory, and you have a chance to to get angry, you know, for many of our patients, you know, they do not have a chance to express the anger towards the offender, you know, like we mentioned, you know, if it is our parents, we feel very unfilial to do that, to express the anger, you know, that, you know, I deserve to be loved, but you did not show me love, right? I did not deserve to be scolded at, you know, for no good reason to be, you know, hit. You know, how dare you hit someone a quarter of your size, right? So all this need to be
processed
out and processed, right? Yeah.
So what about hypnotherapy? Would it be dangerous? Because hypnotherapy is going to tap into the subconscious mind. Now, I believe that hypnotherapy, some say that it's not advisable because you might not know what's going to happen. Actually,
all hypnosis is self-hypnosis, right? So this is another myth we can dispel quickly. All hypnosis is self-hypnosis. I cannot hypnotize you unless you give me permission and you hypnotize yourself. I'm just facilitating your ability, your processes of hypnotizing yourself. You know, that so I know that there are like Christians, you know, out there, for example, they don't encourage people to have hypnotherapy, but actually that is based a little bit on a misconception about what hypnotherapy is, right? But so hypnotherapy is not just any hypnotic processes, but it is a healing process, you know, it's therapy. Right. It's using hypnosis for therapeutic purpose. So like the schema rescripting I was talking about just now would involve hypnotherapy in that sense, right? Because you are asking the patient to go back, you know, in a hypnotic way, right?
Maybe we should have the next webinar on this lah.
Yeah, that is a fascinating topic, you know,
popularized about hypnotherapy
by Freud himself, no less.
Yes, Freud segment. Okay. Now next, because we only have like 10 minutes, so okay, as a bystander, Pat Y asked that as a bystander, what can we do when we observe obvious repeated abuse in action, especially of minors? What are the intervention mechanism or protection for victims available?
Well, I mean, if you observe them in friends or family members, you know, obviously, and it depends on the type of abusers, right? So if you are able to have to talk to the caregivers, right? That would be good, right? I mean, in Western country, they have very strict action that you can do. You can, you know, give a report and right, social service will come and check things out, right? But in Malaysia, I don't think that is as easy, yeah, to do that, right?
I spoke to the SAC before, and like I mentioned, I spoke to the SAC before. It's the criminal justice systems are very different. So we need to understand on the justice systems first before you go make a report and all that.
Yeah.
Okay. Now the next question: when something can affect the person like a trauma, do you think since early childhood, maybe before that, like in the pregnancy period?
Well, yeah. Of course, the whole birth event is pretty traumatic, right? So we have a therapy called rebirthing to bring back, you know, like Kamini was asking about the physical memory. So even the memory of being born is stored in us. So many of this physical memory, you know, traumatic event is during birth itself, right? Or even in being conceived, you know, when your mother experienced trauma, right? That itself would pass down to the fetus even. So we have a rebirthing therapy, for example.
If I'm not mistaken, that's under hypnotherapy. They have a term on it that to No, that they go through back to the pregnancy where they have the memory.
So that is a rebirthing therapy that I was training also. You know, there's a book called Primal Scream. That was written by the psychologist who pioneered this technique, and you know, we would spend days, and I've done that, you know, days with a facilitator trying to get back to that process. You know, we trying to rewire back, all right, to get in touch first with that trauma, right? And a lot of my fellow trainers, we were literally sick and you know, screaming and everything, you know, when subconsciously we got connected back, and then we reprocess that, right? So yeah, so trauma, you know, do not just can be regressed to childhood. It can regress back to the birth process, and even to the conception, not conception, but during the period when you're in the womb, right? So that's
okay. Next question from Raj. Hi, Raj. Thanks for your questions. Based on what's been mentioned, what are your thoughts on nature versus nurture? Example, can someone be born evil? And if yes, can any treatment even remotely address that?
Well, I'm not sure how this is linked to trauma per se. I mean, we are saying that you know, many abusers themselves have been abused, right? So but the question of nature versus nurture, I think is intimately linked, but there are certainly some physical evidence that there are, you know, some people that are have less ability to empathize, right? So that there are like mirror neurons, for example, in our brain, and it has been shown that some people might be less capable of having their mirror neurons firing, you know, to the experiments on their eyes dilation, for example. All these might be part of the physical features that you know, but it is arguable whether these are due to history of being abused or not, right? So it is a complex question. There are twin studies, for example, that show that
the environmental or the biologically.
That there might well be some physical contribution, underlying physical contribution, in addition to environmental, right? But and the environmental features are certainly very strong, you know, and we would want to embrace use the model of epigenesis, right? Which is the fact that even whatever physical features you have, you need the environmental factor to turn it on, right? So it is in interaction.
Now, interestingly, when Raj asked this question, right, it actually something that just came up my mind, like psychopath, right? They're born that way. Are they? Like, okay, a lot of child, when they start to have the traits of being the abuser. What are the treatments that can
yeah, I mean, if you have you know, a child that come to see you, you know, which we have, they torture cats and kill animals, you know, so that is some telltale sign that you know, things are not going well, right? So you might then want to do some rehabilitation and help them to develop empathy, right? So empathy can be, you know, can be assessed, can be tested. You know, we have the emotional quotient, for example, emotional intelligence quotient that we, you know, we use to assess children, you know, youth and adults to look at their sense of empathy. right? So all these can be treated. We have a therapy for that, you know. Yeah, and of course, certain neurodevelopmental condition like ASD, right? Autistic spectrum disorder, people have less empathy, and that there have been cases in America, you know, of mass shooting linked to people with ASD, for example, right? So so that all need to be further explored. I know we are not clear is a one-to-one connection per se, right?
Okay.
But it's complex relationship.
Now we have covered almost everything. We only have 5 more minutes. What about, let's talk about medications for the last 5 minutes. Medication on trauma.
Right.
Wait, sorry, doctor, sorry. Is there a known approach to dealing with PTSD coming out of loss? Questions from
yeah,
anyone?
I mean it is similar, right? With PTSD that can be losses. So with the rescripting, empty chair, these are very good way of processing loss, and of course expressive therapy, right? We have courses on art therapy, music therapy, or these good ways to process emotions. I mean, at the end of the day, all emotions, you know, loss, anger, all these need to be processed, right? Once they are processed, you know, and that's why we have all this therapy to help our patient to process them, then that can be managed much better. But before that, we need to acknowledge, right? To acknowledge that trauma exists, that we have suffered this trauma, so that we can then deal with them rather than avoid them or minimize them or rationalize them, right? Yeah. So in terms of medication, well, depends, right? Whether you use the medication to avoid, to numb yourself, right? Or to learn. So there are some medication that help you to learn better, right? So we have lab tests, you know. So we can mention the WellLab website, you know, that we can measure hormones, neurotransmitters, and that would help us to, like, Puvana, can you mute yourself, please? Right. Yeah. So all this can be tested, you know, lab test done, you know, and to know what would be appropriate in terms of medication, whether pharmaceutical or nutritional.
Okay, so everything can be tested. Also, you do have a facility that at IPC, right?
Yep, yeah, IBC, we have a psychiatric as well as a psychologist, and some of our patients on PTSD are indeed on you know, pharmaceutical medication to help them cope with those trauma, so that can help as well. Yeah.
Okay, we have another 2 more minutes. If you have any more questions, please do feel free. Or else we are going to just do a quick recap. So what we've been speaking about today about trauma and all that. So as a therapist, yes, just to wrap up, if I'm not wrong, correct me if I'm wrong, doctor. As a therapist, yes, we can tap back into the traumatic event, but make sure that you have the skills. Always have a very good bonding session with your patients before you do any treatment. And also beware of the places that in their mind that they do not want to go back to. Have talk with your patients first.
Well, yeah, you need to provide those precaution, right? That they know whenever they want to, they can get out of it.
And also make sure that you have the skills in case the subconscious rejected and it became a full-blown
yeah, then
problem.
you need to watch out for it and help them to.
Yeah. Then we will have to call Dr. Edward for that.
Well, hopefully you'll be trained to be able to deal with that, you know, and embrace your inner critic, because all these punitive parents, critical parents we have, you know, we ourselves have internalized them, and we are our worst enemy. You know, they're always in our voices, you know, the voice in our head. So we need to learn to deal with all those voices.
Yeah. So for those who are interested to get the books, you can go to our International Psychology Center website, IPC. You can look for that. And if there is no more questions, anything you want to wrap up, Doctor?
Well, there's hope, right? And trauma, not especially complex trauma, is more pervasive, right? So we need to not minimalize it and deny it, and learn how to embrace them, acknowledge them, and then deal with them. It doesn't mean that we are being unfilial to our caregivers and parents, right? And all these emotions need to be processed, so that in turn we ourselves can be good parents.
Okay. For our next webinar, has the topic title out already? Not yet.
You'll be announced soon. If anyone have some suggestion to send to us.
Yeah, can text me as well if you have any suggestions, any topic that you would like to have us to have a webinar on that. So if everything is all done, all covered, we try to cover it as much as we can in this 1 hour. Right. Thank you so much, Dr. Edward, for having me as your co-host, and thank you so much to our students, our friends, and to those who joined us today. Thank you so much. We'll see you on the next webinar.
Well, thank you, Joanne, for being a wonderful host, and I did enjoy very much our chat.
All right. Thank you. We'll see you guys next session.
Bye-bye.
Thank you. Bye-bye, and have a good evening.
Bye.